Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, the doctors talk to you about birth control options.
Hello, I am Dr. Dana Bach. I am a board-certified anesthesiologist. I practice in Oklahoma City at Lakeside Women's Hospital. I am here visiting with my friend and colleague. This is Dr. Aaron Armstrong. Thank you, Aaron, for joining us today.
Thank you for having me.
You bet. Dr. Armstrong is a board-certified OB-GYN, and he wants to talk with us today about birth control options. So, Dr. Armstrong, if I was a patient, and I was a little younger, and I came into your office and said, hey, I don't want to get pregnant. What can I do to not get pregnant? What are my options?
Well, first and foremost, there are so many options out there now these days and available for patients. And I think it's really exciting what is available now these days. And it really has options out there to really fit what you want and kind of your personality as well, too. I think I always greatly appreciate patients that are honest with themselves because I think it helps them to find a birth control that works best for them. So when we do talk about birth control, I think one of the most important things to talk about is how effective a birth control is. And so we do have what's called failure rates because not everything's 100%. Not even if we tie your tubes, studies have shown that's not exactly 100%. Less than 1% failure rate, but it's not exactly 100%. So most birth controls that get into that area where they're that effective, we're talking about birth controls that are long-acting and reversible. So IUDs, small T-shaped devices that fit up inside your uterus, those are very effective birth control and are just there and left for many years until they have to be replaced. There's also a little device that fits underneath your arm through a small procedure that we do in the office. It's a very effective birth control. It lasts for about 3 years. And you don't have to remember to take anything on a daily basis. That's one of the great things. Those are both very, very effective birth control. And a lot of patients have been very, very happy with them. There are other ones that are not quite as long-acting, not quite as effective for years, but things such as the Depo-Provera shot. It's a shot you take every 3 months. There's also patches, which are little stickers that you put on once a week. You can utilize those as birth control. And there's also a thing called a NuvaRing. It's a soft rubbery device that fits inside the vagina. It stays there for about 3 weeks. So I think those are great options. The Depo shot, the patch, or the NuvaRing. Those are great options for patients that are honest with themselves and say, hey, I may not remember to take a pill every day, but I can remember to do that on a routine basis. So those options, the Depo, the patch, and the NuvaRing, they're not quite as effective. Their failure rates are not quite as good as getting your tubes tied or the IUDs, but they're still very, very effective. And then one of the most common forms is the oral pills, birth control pills. And that's where you see some of the most options out there. And I think it's important to know that not every pill is the same. There are multiple pills out on the market. Most birth control pills have 2 components to them. They have an estrogen and a progesterone component. The estrogen is mainly the same compound for every pill, but there will be a little bit in concentration differences. So you may hear some birth control described as low, or low. That's referring to the estrogen component. The progesterone component, there's actually 4 different classes of progesterone, and each class has about 2 or 3 different medications in it. And each class has a little bit different side effect profile. So for some patients that have taken a birth control pill in the past and they weren't happy with it, either they didn't like the side effects that came along with it, then there are options to try a different progesterone form to see if patients do better with those pills and those side effects that come along with the pills. So I think the lesson is that if you've tried a pill in the past and didn't like it, just know that there are multiple options out there that are not the same as the pill you've tried in the past and do have a little bit different effect to them.
Perfect. So if you, as a patient, think, I don't want to get pregnant in the next 6 months, but I might within the next year, then what would be one of the pills would probably be a better option?
Yeah, you could the pills, the ring, the patch. Those are really some of the best options for kind of a short-term use of birth control. And so if you start getting into talking about the depot shot, the device that goes in your arm, or IUDs, that's a more kind of long-term thought as far as, because those are a little bit more costly up front. And so that you want to think about utilizing those for a longer time frame. So, but yeah.
What if, I guess you talked about the longevity and how long each of those will last, and tubal ligation or the surgical
approach.
Yeah. Can you elaborate a little bit on it? I know you said that it's not 100%, but almost 100%.
Yeah. We say it's not 100% because that is the data that we have. And that was done on an old form of birth control. There is now these days, majority of tubal ligations are actually done where instead of just cutting the tube or removing a small portion of the tube, we actually remove the entire tube at this point. And I think we're going to see long-term data that they're working on that the failure rate is much better as opposed to just removing a small portion. So a tubal ligation is a surgery. It's normally an outpatient surgery. So you had the procedure and you're able to go home the same day. Normally we can do it laparoscopically, so very small incisions on your abdomen, and we're able to cut and remove the tube at that point. Tubal ligations are just strictly a birth control. They give no period control because all we're doing is with the tubal, we're creating a roadblock. We are blocking the sperm from being able to get to the egg. But as far as period control, there is no period control that goes along with the tubal ligation.
Okay, that's been very helpful.
Yeah.
Anything else that we haven't discussed or that you often get asked about when patients come see you in the office?
Well, I think as far as talking to patients about birth control, it is sometimes a challenge to patients. They get frustrated because it's a little bit of a trial to figure out what form of birth control works best for them. But I do encourage patients to think about their options. Most of the time, the symptoms that are associated with birth control do resolve, such as breast tenderness or nausea. And they resolve much faster than if you were pregnant because the nausea is going to last much longer. The breast tenderness is going to last much longer for sure. So I think if you have to put things sometimes hopefully in perspective about the benefit that's there. But fortunately, like I say, I think one of the greatest things to tell patients these days is that there are so many options that are out there. And just because one thing didn't work well for you in the past doesn't mean that there's not the right one out there for you. I encourage you to reach out to your OB-GYNs here at Lakeside and ask them questions about their birth control options. But so you've got a lot out there. You do. And it allows you to take control of your life at that point.
Okay, that sounds perfect. Well, thank you so much for joining us today. And you've helped shed a lot of light to me. When I was younger and needing birth control, there weren't that many options.
No.
There really weren't.
No, there weren't.
So nowadays there are lots of options. And like you said, it's good to think about how you as a patient will take care of using those options and being faithful using whatever contraception device you are wanting to use.
Absolutely. I think that's a great thing because patients that are honest with themselves and say, hey, maybe a daily birth control pill is not the best for me because I know that I will forget that. I think it's great now that there are so many options out there for those patients that don't have to remember to take a pill every day. and can still have the benefit of birth control.
Perfect. Well, thank you for joining us today.
Well, thank you for having me. Greatly appreciate it.
You bet. Bye-bye.
Bye.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please contact us at SheTV.com if you have comments or a particular subject you would like us to address.